Hello, friends. The real cost of a nursing home in 2026 is not the monthly bill. It is what that bill does over time. If you are 65 or older, on Medicare, and you own a home or have savings you want to protect, here is the number. At current benchmark rates, the average nursing home stay runs about $298,000. The bill is bad enough. What really wipes families out is learning too late that Medicare was never going to cover the long stay, that Medicaid thresholds are not what most people assume, and that the 5-year transfer rules only become visible after the crisis has already started. 5 things decide whether that number destroys your plan or not. Hello, friends. Grab a pen, because this is not one rule. It is a chain reaction. The price of care is the first hit. Then comes the Medicare gap most families discover too late. Then the Medicaid math that is not nearly as simple or as devastating as people assume. Then the home care trap that quietly costs more than the facility. And then the 5-year rule that punishes the exact move families make when they panic. 5 things in the order they hit. At least one of them applies to you or someone you love. Write down the ones that matter, and by the end you will have the numbers, the rules, and the exact words to say. These numbers move. The co-insurance amounts change. The state Medicaid thresholds change. The survey benchmarks change. The people subscribed here find out before the money slips away and before the window closes. Subscribe now and let's get into it. Before we go further, I need to address something, because people hear a topic like nursing home costs and immediately sort themselves into one of 2 groups. The first group is comfortable, some savings, maybe a paid-off home, maybe a decent retirement account. And they figure this is for people in worse shape, people who are already broke. The second group is living on a fixed income, counting every dollar, and they have learned to assume the real protections are always for somebody else, that the rules only help people with money or lawyers. Both of those assumptions are wrong about at least one of the items I am covering today, and on every single one I will tell you exactly which group it helps most and how. The comfortable group is going to be surprised by the Medicaid section. It is not what you think. The fixed income group is going to be surprised by the 5-year transfer rules, because homeowners at any income level can trip them. And stay to the end, because that last one, the 5-year trap, is the one families trigger when they try to protect the house too late. That is the item where the timing is everything, and most people only learn the rule after the clock has already started. Now, let's start with the raw numbers. Number 1, the sticker shock. Most families think the danger of nursing home care is one scary monthly number, one bill, one hit. The real problem is what that number does when you multiply it across the time people actually spend in care. Here is the current national benchmark from the 2025 Care Scout Cost of Care Survey, the most recent clean data we have, published March of 2026. A non-medical home care aide, someone helping with bathing, dressing, meals, runs a national median of $35 per hour. If your family needs that aide 44 hours a week, that is $80,080 a year. An assisted living community runs $6,200 per month, or $76,200 a year. A nursing home semi-private room, 2 beds in a room, runs $9,581 per month, or $114,975 a year. And a private room in a nursing home runs $10,798 per month, or $129,575 a year. Now here's the number most people never calculate. Someone turning 65 today has almost a 70% chance of needing some form of long-term care. Among people who use nursing home care, the average stay is 2.3 years. A private room at $129,575 a year for 2.3 years is about $298,000. That is not a worst case. That is the average use pattern at the current benchmark rate. This section helps both groups. If you are on a fixed income, 1 year of this can overwhelm everything. If you are comfortable, $298,000 can erase what you thought was a solid cushion faster than you ever planned for. Here is what to do right now. Write down 4 benchmark lines on a piece of paper. In-home hourly rate, assisted living monthly, semi-private nursing home monthly, private room monthly. You can look those up on the Care Scout Cost of Care tool or compare licensed facilities at Medicare Care Compare on Medicare.gov. When you call a facility, use these exact words. I want your current private pay monthly rate, any level of care add-ons, and whether medication management and overnight supervision are included. That is number 1. The price is ugly enough. The next problem is worse, because many families still think Medicare handles the long stay. Number 2. The Medicare myth. The most common version of this belief sounds like this. Medicare covers 100 days in a nursing home. That is not how it works. and families who plan around that sentence get blindsided at exactly the wrong moment. Here is what Medicare Part A actually covers. It covers skilled nursing facility care, and that means short-term rehabilitation after a qualifying hospital stay, not custodial care, not the long stay most people mean when they say nursing home. Medicare itself says it plainly. Medicare does not cover long-term custodial care if that is the only care you need. And even the short-term benefit has walls around it. First, you need a medically necessary inpatient hospital stay of at least 3 consecutive days, not observation status, inpatient. That distinction alone trips up thousands of families every year. If you clear that bar, here is the coverage. Days 1 through 20 in a skilled nursing facility, $0 for covered services. Days 21 through 100, you pay $217 per day in 2026. After day 100, Medicare pays nothing. You pay all of it. So even inside the so-called 100-day window, there are 80 days of coinsurance. $217 a day for 80 days is $17,360 out of your pocket. And after day 100, the entire bill is yours. This helps both groups equally because the myth crosses every income line. The fixed income household often assumes Medicare is the safety net that will catch them. The comfortable household often assumes their good supplemental insurance means long-term care is handled. Neither is true for custodial stays. Nobody is automatically covered for the long haul. Here is your action step. Before any discharge, before you sign anything, get the stay labeled correctly and demand the written distinction between skilled rehabilitation Medicare will cover and custodial long-term care Medicare will not. Call Medicare at 1-800-633-4227. Talk to the hospital discharge planner. Use these exact words. Before we sign anything, I need the written difference between skilled rehabilitation Medicare will cover and custodial long-term care Medicare will not cover. And mark 2 dates on your calendar. Day 21, when the $217 daily coinsurance starts, and day 100, when Medicare coverage ends entirely. None of this is automatic. Nobody sits you down and explains the difference between skilled and custodial before the bill arrives. That is number 2. And once that Medicare window ends, the conversation changes from coverage to assets. Number 3, the Medicaid threshold. Now, everything I have covered so far has been about the bill, what care costs and what Medicare will not pay. This next part changes the whole picture, because now we have to talk about what the state counts and what it does not. I need you to hear this one carefully, because this is the section where comfortable retirees usually tune out, and you should not. Most people hear Medicaid and think total ruin. They think it means losing everything, the house, the savings, all of it, and that it only matters if you are already poor. Both of those beliefs are wrong, and both of them lead to bad decisions. Medicaid is the primary payer across this country for long-term care services. It is not a marginal program. It is the system most nursing home residents eventually depend on, and it has specific thresholds, specific protections, and specific rules that vary by state. Here are the 2026 federal baseline numbers. To qualify as an individual, your countable resources generally cannot exceed $2,000. For a couple, $3,000. The special income cap in many states is $2,982 per month for an individual. That is 300% of the SSI federal benefit rate. Now here is where the comfortable group needs to pay attention. When one spouse enters a nursing home and the other stays in the community, there are spousal protections built into the law. In 2026, the community spouse can protect between $32,532 and $162,660 in countable resources, depending on the state. The community spouse can also receive a monthly maintenance needs allowance of up to $4,066.50. Let me put real numbers on this. A couple with $180,000 in countable resources is not automatically facing a total wipeout. Under the 2026 Maximum Community Spouse Resource Allowance, the protected amount could be up to $162,660. Add the $2,000 applicant standard. The amount above those two protected totals could be closer to $15,340 before exempt assets like the home are even analyzed. And speaking of the home, in 2026, home equity limits range from $752,000 to $1,130,000, depending on which limit your state has chosen. That is not lose the house. That is a specific, calculable threshold. This section helps the fixed income group most because it shows that Medicaid is not a vague poverty label. It is a system with real protections you can plan around. But the surprise is for the comfortable group. These rules matter to you too, because middle-class couples with a home and savings can hit these thresholds faster than they expect. And the spouse protections only work if you know they exist before the crisis. Here is your action step. Call your state Medicaid office. You can find it through the Medicaid State Overviews page at medicaid.gov, or call the Elder Care Locator at 1-800-677-1116. Ask for 5 specific numbers. I need my state's nursing home Medicaid asset limit, income cap, community spouse allowance, monthly maintenance allowance, and home equity limit. Write them down. Those 5 numbers are your planning baseline. Your state's rules may differ from the federal floor, and they almost certainly do. That is number 3. But even before you hit Medicaid, there is another mistake that drains savings quietly, assuming home is always the cheaper answer. Number 4, the cheaper at home illusion. This is the most emotionally loaded decision in the whole chain, and I want to address it with respect. Families want their parents at home. That instinct is human, and it is good. But when the instinct drives the math instead of the other way around, families end up paying more for the option they assumed was saving them money. Here is how the numbers actually work. A non-medical home care aid at the current national benchmark runs $35 per hour. Once your family needs that aid for roughly 44 hours a week, which is not around the clock, that is about 6 hours a day, 7 days a week. The annual cost is $80,080. The current assisted living benchmark is $76,200 per year. Read that again. At 44 hours a week of home care, staying home is not cheaper. It is about $3,880 a year more than the assisted living benchmark. And assisted living at that price typically bundles overnight supervision, medication management, meals, and social structure that home care at 44 hours a week does not include. A viewer wrote to me about her mother's situation. Margaret, 79, outside Louisville, retired librarian. Her family kept insisting that home was obviously the cheaper choice. They were not wrong at first. When the hours were low, home care was less. But the needs climbed. Once help reached the equivalent of 44 hours a week, the benchmark home care cost was $80,080 a year. Assisted living benchmarked at $76,200. The family sat down and ran the side-by-side worksheet. Home care at the actual hours needed, assisted living at the actual level of care needed, and a semi-private nursing home room. 3 columns, same page, no assumptions. The difference at that point was $3,880 a year, and that was before counting what assisted living bundled that home care did not. That $3,880 does not sound enormous on its own, but it compounds. And the real cost is what families lose by refusing to do the comparison until the crisis is already moving. This section helps both groups. Fixed income families cannot afford to overpay by nearly $4,000 a year on an emotional assumption. Comfortable families can absorb it longer, but the same blind spot means they burn through reserves faster without realizing the facility might have been the better value option months earlier. Nobody runs this comparison for you. No home care agency hands you a worksheet showing you would pay less at a facility. No facility calls to say your home care costs have crossed the line. You have to force the comparison yourself. Here is your action step. Get 3 quotes on 1 page. Call the home care agency, the assisted living community, and the nursing home and say, please quote this 3 ways. Home care at the hours we actually need, assisted living at the level of care we actually need, and a semi-private nursing home room. Same page, same math. Then decide. That is number 4. So now we get to the last and most dangerous part. What happens when families try to protect money after the 5-year clock already matters? Number 5, the 5-year trap. This is the item I told you to stay for, and this is the one that catches families who think they are being smart at exactly the wrong moment. The misconception sounds like this. If I just move the house into the kids' names or gift money to family now, I can protect it before Medicaid takes it. That logic feels right, and it is the single most dangerous late move a family can make. Here is why. Medicaid has a transfer of assets look-back period. When you apply for Medicaid nursing home coverage, the state reviews every financial transfer you made during the previous 60 months, 5 full years, every gift, every sale below fair market value, every transfer into a trust. If the state finds that you gave away assets for less than fair market value during that window, it does not just note it. It calculates a penalty, measured in months of Medicaid ineligibility. The formula is straightforward. The state takes the amount you transferred and divides it by its own average monthly cost of private pay nursing home care. The result is the number of months you cannot receive Medicaid coverage, starting from when you would otherwise have been eligible. The penalty is not symbolic. It lands at the worst possible moment, when you need care, when the money is gone, and when the transfer cannot be undone. And it does not stop at gifts. Revocable trusts funded with the applicant's assets are generally treated as available resources, meaning Medicaid counts them as if the money is still yours. Irrevocable trusts are generally treated as asset transfers, which means they can trigger the same look-back penalty if the fair market value math does not hold up. And after all of that, there is estate recovery. States are required to seek recovery from the estates of certain Medicaid beneficiaries age 55 and older for nursing facility services, home and community-based services, and related hospital and prescription drug costs. So the idea that the house is automatically safe after I'm gone is also not reliable. This section helps the comfortable group most, people with homes, savings, and the instinct to move assets when the diagnosis comes. But here is the shock for fixed-income homeowners. If you own a house and nothing else, you are not exempt from these rules. The home can be subject to estate recovery. The late transfer of a deed can trigger a penalty. The 5-year clock applies to you too. Here is your action step, and this is the exact word script I want you to write down. Do not gift money, retitle the house, or move any asset until you understand your state's specific rules. Call the Elder Care Locator at 1-800-677-1116 or go through your state Medicaid office and say this: before we move a dollar, I need my state's look-back period, transfer penalty divisor, estate recovery scope, and the rules on trusts and home equity. That is the sentence. Write it down. Use it before you move anything. The 60-month look-back period is the deadline that matters here, not a filing deadline, a planning horizon. And most families only learn it exists after the clock has already been running. That is number 5. So here is the full picture. The first thing is the raw benchmark cost, $114,975 to $129,575 a year for a nursing home room, with home care and assisted living often not far behind. The second thing is that Medicare is not long-term care insurance. It is short-term skilled coverage, and even that leaves $217 a day on the table in 2026. The third thing is that Medicaid is not a vague poverty label. It is a specific threshold system with spouse protections, income caps, and home equity rules you can plan around. The fourth thing is that staying home is not automatically the cheaper answer once the hours climb. And the fifth thing is the one people learn too late. The 5-year transfer rules punish the panic move. Medicare does not turn custodial care into skilled care because the building has nurses. Medicaid does not ignore gifts because they were made to family. Your state does not calculate spouse protections for you before a crisis. A facility does not volunteer the cheapest workable path unless you ask. A policy in a drawer does not protect you if you do not know what it still covers. The one cost that destroys savings is not dangerous just because it is large. It is dangerous because the rules arrive late, the bills arrive fast, and none of the protection is automatic. Now I need you to think of one person, a parent, a neighbor, or the one couple you know who say they are fine because Medicare will handle it. Share this with them. Not because they are struggling, because the odds are very good they have never seen these rules laid out in this order, and the window to plan is always before the crisis, never during it. Subscribe, share this with one person who needs it before a crisis, and I'll see you in the next one.